Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on neuroanatomy of the peripheral nervous system, PNS, each with 4 answer choices and detailed explanations. Vignette 1, Carpal tunnel syndrome. A 45-year-old secretary presents with numbness and tingling in her thumb, index, and middle fingers, worsening at night. She experiences weakness in thumb opposition. What nerve is affected? A. Ulnar nerve. B. Median nerve C. Radial nerve. D. Musculocutaneous nerve. Answer: median nerve. Explanation: carpal tunnel syndrome results from median nerve compression at the wrist, causing paresthesia in the first 3 digits and weakness of thumb opposition, thenar muscles. Vignette 2. Ulnar claw hand. A 32-year-old cyclist presents with clawing of the 4th and 5th fingers at rest, along with weakness in finger abduction and adduction. Where is the lesion? A. Radial nerve at the wrist. B. Median nerve at the carpal tunnel. C. Ulnar nerve at the wrist. D. Ulnar nerve at the elbow. Answer: C. Ulnar nerve at the wrist. Explanation: ulnar nerve injury at the wrist leads to clawing of the 4th and 5th digits, loss of lumbricals, and weakness in interosseous muscles. Vignette 3. Radial nerve palsy, Saturday night palsy. A 25-year-old man falls asleep with his arm draped over a chair. The next morning, he has wrist drop and cannot extend his fingers. Which nerve is affected? A. Median nerve. B. Radial nerve. C. Ulnar nerve. D. Axillary nerve. Answer: B. Explanation: radial nerve compression in the axilla from prolonged pressure causes wrist drop, loss of finger extension, and numbness on the dorsum of the hand. Vignette 4. Winged scapula. A 37-year-old woman undergoes a right mastectomy with axillary lymph node dissection. She later develops winging of the scapula when pushing against a wall. What nerve was injured? A. Thoracodorsal nerve. B. Long thoracic nerve. C. Axillary nerve. D. Spinal accessory nerve. Answer: B. Explanation: the long thoracic nerve C5-C7 innervates the serratus anterior, which stabilizes the scapula. Injury causes a winged scapula. Vignette 5. Herb Duchenne palsy waiter's tip. A newborn has arm adduction, medial rotation, and wrist flexion after a difficult shoulder delivery. What part of the brachial plexus is affected? A. Lower trunk, C8-T1. B. Upper trunk, C5-C6. C. Posterior core. D. Long thoracic nerve. Answer: B. Explanation: Herb Duchenne palsy results from upper trunk C5-C6 damage during birth trauma, affecting deltoid, supraspinatus, biceps, and infraspinatus muscles. Vignette 6. Klumpke palsy, total claw hand. A 34-year-old woman falls while hanging from a tree branch. She now has clawing of all fingers, intrinsic hand muscle atrophy, and sensory loss on the medial forearm and hand. Where is the lesion? A. C5-C6 roots. B. C8-T1 roots. C. Median nerve. D. Radial nerve. Answer: B. C8-T1 roots. Explanation: palsy results from lower trunk C8-T1 injury, affecting intrinsic hand muscles, lumbricals, interosseous thenar, hypothenar, and causing total claw hand. Vignette 7. Foot drop. A 58-year-old man with diabetes presents with foot drop and sensory loss on the dorsum of the foot. He cannot dorsiflex or evert his foot. Which nerve is affected? A. Tibial nerve. B. Common peroneal nerve. C. Femoral nerve. D. Obturator nerve. Answer: B. Common peroneal nerve. Explanation: the common peroneal nerve L4-S2 is vulnerable at the fibular neck and controls dorsiflexion and eversion. Lesion: foot drop. Vignette 8. Sciatic nerve injury. A 40-year-old man receives an intramuscular injection in the gluteal region and later develops weak knee flexion and foot weakness. What nerve was likely injured? A. Sciatic nerve. B. Femoral nerve. C. Obturator nerve. D. Pudendal nerve. Answer: A. Sciatic nerve. Explanation: the sciatic nerve L4-S3 supplies the hamstrings, tibial, and common peroneal nerves. Injury: weak knee flexion and foot dysfunction. Vignette 9. Meralgia paresthetica. A 52-year-old obese man complains of burning pain and numbness over the lateral thigh. Symptoms worsen with tight belts. Which nerve is affected? A. Femoral nerve. B. Lateral femoral cutaneous nerve. C. Obturator nerve. D. Sciatic nerve. Answer: lateral femoral cutaneous nerve. Explanation: Neuralgia paresthetica results from compression of the lateral femoral cutaneous nerve, L2-L3, causing lateral thigh numbness and burning pain. Vignette 10, pudendal nerve block. A woman in labor requests pain relief for vaginal delivery. The doctor injects a local anesthetic near which landmark? A. Ischial spine. B. Greater trochanter. C. Femoral triangle. D. Sacroiliac joint. Answer: A. Ischial spine. A pudendal nerve block is given at the ischial spine to numb the perineum and genital region during labor. Final thoughts.